I'm in the right one. Okay. Hi, Antoinette. Thank you for joining me on this early live, which will be very short today. I will only be on for the next 35 minutes or so. Sorry about that, but I am here. Hi, Michelle. Thank you for joining me. Okay. There we go. All right, so we're going to talk very quickly about career progression in health information and medical coding, or if you have a degree in health information technology or in health information management. I will only be here till the top of the hour. So this is going to be a very quick live. And once I get done saying all I need to say, then I'll take questions. Thoughtful questions. Do not ask me how to get started. I will tell you to watch my channel. Please, for the love of Peter, Paul, and Mary, watch the channel. Like, there's so many videos and there's so many things that can address your attention. Anything that you need, trust me, it's there. I got everything, okay? So, hi, Nicole. So, when you become a medical coder, right, there's sometimes people will say, well, when I get experience, I want to do auditing. Okay, that's great. If you're saying that you want to get experience first, then you want to get into auditing. That's good, because no one, and I mean no one, should be an auditor, should be an instructor, should be anything having to do with any kind of influence to coders within the first 2 years and with no experience. You should never, ever do any of those things, because of the simple fact that you need experience. You know, there's a lot of people, especially now on LinkedIn, I don't know what kind of moxie or what y'all are drinking, because there are so many people on there that they're brand new CPCAs and they're speaking like they know and they don't know a lot of these things. This one had all the credentials out. Oh, this is what these credentials do. And again, it's wrong. They're wrong. And when they talk about the CCA and they talk about the CCS, it irritates me, because if you don't know what you're talking about, please sit down. Because they said that the CCS is just for inpatient coding. No, the CCA and the CCS both cover inpatient coding and outpatient coding. When you want to talk about these credentials, you need to state that. Don't just say, oh, this is only for inpatient coding. Because somebody who only has an inpatient credential, like maybe the CIC, and if they hear that, oh, well, then I can get the CCS. Not thinking or not knowing that, hey, there's also outpatient on those exams too. So when you bring information, you better bring it straight and you better bring it right. I seen another one that is a CPCA, very proud also, did an article about modifier 25. Love, you may think you know, but your article clearly showed that you didn't know. And this is why I say, when you are progressing in this career field, you need to do it at a pace that is correct and right, because everybody's looking at us as we are the subject matter experts. These physicians, they don't know about these credentials. They don't know what a CPCA is. They don't know what a CCA is, or a CCS, or a CPC. They have no idea. So if you go and you say something out of turn, really, because you don't know and you're saying these things wrong. To talk about modifier 25 and in a way that is incorrect already because you want to be out there educating folks, somebody's going to see that and that's what they're going to automatically think. Another coder is going to see that, somebody that's brand new doesn't know any better, and they're going to go in thinking that that's okay, that that's the right way, and it's not. They were blatantly wrong. And so that's the thing. You have to, when you have the professional maturity to know what you're doing, even for myself, when I'm writing anything or when I'm doing anything or even when I'm putting presentations together, I look at it over and over and over again. I make sure that I have like my references and everything, and I will ask my friend Jessica if it's questionable, I'll ask her like, what do you think of how I said this? And she'll say, yeah, it looks good, or she'll be like, well, I would also add this. And so there's lots of things that are helpful by seeking that feedback. I don't think that person that wrote that article on LinkedIn seeked anybody's feedback, because if they did, they would have caught the very first error right out of the gate, and to keep that embarrassment from happening, because it is embarrassing. You're speaking out of turn and you're doing something outside of what you should be doing. If you are a CPCA, if you are a CCA, if you are a CCS, if you are a CPC, you have less than 2 years of experience, you need to be coding. That's all you have time for right now, is to code and learn and read and listen and pay attention. Don't speak out of turn, just learn. So that way when you're progressing at a good pace. Not, oh, well, I want to be an instructor. Do you know that there's people who are instructors who have never had any coding experience? Are you freaking kidding me? How do you do that? But people allow that to happen. And this is who's training the next generation of medical coders? Are you serious? Oh, Blue, no, there's going to be the AI. AI is dumb. Did you know AI is dumb? It thinks in a series of zeros and ones, and whoever is programming it is programming it based on the current rules. We all know that these rules change all the time. We also know that fall and fall can have two different meanings. One can be actually falling down, and one could be the season of the year. Guess who doesn't know that? AI. Guess who cannot make the distinction between a season and an incident? AI. So again, when we take our time to learn correctly, we're going to be able to see those things. And there's not going to be so many errors out there, because I don't even want to talk about the trillions of dollars, millions and billions of dollars that's out there from claims that are inaccurately submitted because somebody is an auditor before their time, before they need to, before they've had experience, before they have any clue of what they're doing, because somebody was an instructor to a group of students who now this group of students has no idea what they're doing, and they're out there doing whatever the physician says because the physician thinks that they know and they don't know, and the coders are too scared to say anything. When you lack professional maturity, these are the things that happen. So all of this millions and billions of dollars that is out there just floating around with incorrect payments and everything, it is because people are talking out of turn. They're doing things out of turn. They're progressing in their career out of turn. Learn. Spend your first 2 years coding. My nurses, it's the same thing for you. I'm looking at you too. Because here we go again. Well, I'm a nurse and I want to be a CDI. Okay, what do you know about coding? Well, that's not what I'm doing, Blue. I'm doing CDI. I understand that. But to fully understand CDI, you still have to understand the coding rules about specificity, about sequencing, about all of these things. When do we pick up sepsis versus we pick up the symptoms versus all these other things? If you don't know that and you're running around being the CDI expert, well, guess what? The physician's going to listen to you because you're a nurse. But if you don't have the wherewithal and the professional maturity to know and understand what's going on with the coding before you go and do that, it leads to more problems. Oh, well, I just have the title, I have a CDI. No, you need coding too. You need coding too. And if you ever want any hope of really making a good impact, because I don't know about you, but for me, when I think about what I'm leaving behind when it's all said and done, I'm not saying anything. I'm just saying, when I think about my career and everything that I'm leaving behind, I want to make sure that it's good. That when they say, "Hey, Bleu is here." Oh, don't worry. Everything was all right. We've got everything. Everything was good. She taught us well. I would hope that people would think that too. But no, there's people that, oh, well, I want this and I want this salary and I want to work from home and I want to do all these things. You have not earned any of that yet. Not one thing. But there is hope out there. At least I saw that hope with one of my nurses. One of my nurses followed my independent self-study syllabus when I had it out and free, because there's people that are just ungrateful. Okay, so I took it down. I'm restructuring it right now. I'm still working on it because it is comprehensive. Again, I want to make sure that people know if it's going to be what I tell these people, well, I want it to be complete and I want it to be comprehensive. But she followed it. She followed what I had put out there because it was good and it still helped lots of people to study on their own, skip these fast-paced medical coding programs, or just supplement the medical coding programs they were in. And they ended up studying and then they passed. This nurse went through and she studied. Well, her whole goal was to get to CDI. She heard me. She heard me because her first stop was CDI. But she heard me when I said, make sure that you are studying the coding first. It's not a requirement in the industry. However, there are things that if you are in the know, you know. And she wanted that. So she started studying with the self-study syllabus. Then she got her first job in coding. She said she took a pay cut, but she said it was okay because she looked at it like paid training. And I was like, well, that's a great way to look at it. And now, 2 years later, she's working in her dream job as a CDI, and she's making more money than she did at the bedside. So what does that say? That when you progress like you're supposed to, things are not going to be hard. Things are going to fall into place like they're supposed to. But again, if she just jumped right in, she would have lost that big piece of the puzzle. Now think about that nurse. That nurse is going to know exactly what those coders are going through. She's going to know exactly what they're saying when they're saying, hey, we have this doctor, he does this and he does this, because the CDI is that liaison. No matter what anybody else tells you, the CDI is the liaison between the coders and the providers. They're the ones who are going to provide a lot of that education. And yes, it is part of what their duties are. Do they wish that they could just concentrate more on doing the CDI part? Absolutely. But that's not the way that the real world works, okay? They are there to provide education not only to the coders, but to the providers as well. And so when they're in the middle and they can speak coder and they can speak physician, right? Because they've worked with them before. Well, that's what happens. Then there's that good synergistic working. That's what happens. But when you don't do that, when you just jump right in, because what do you know? You don't know me. I know a lot. And there's a lot of things that y'all don't know. So when I'm telling you, I'm speaking from knowledge, from experience, from being in the industry, boots on the ground. I know. And so when you do like you should, when you're studying for coding, you want to get into coding. You want to eventually get to CDI, you start with the coding. You don't do patient access. You don't do reception. You do jobs like working for professional fee. You do maybe a temporary stay in risk adjustment, less than 6 months, so that you can get yourself familiar with all of those things. If you want to, you don't have to. You can work in medical billing. You don't want to do that? Fine. Prior authorizations, because that's a lot closer than you trying to be over there at patient access, where you can get stuck and people will take advantage of you because, oh, well, the coding, when you're never going to use coding in patient access. Okay? You're never going to use it there. And I don't care what anybody else says. Oh, you're getting the full picture of all of this. No, no, no. You don't need that if your ultimate goal is to be in HIM, is to be in coding. You don't need all of that other stuff, because that is for people who do not have technical training. If you have technical training like coders do, even if you studied on your own, that's what you need to be focused on. Not in positions like reception, secretary, patient access, none of those. That is not for you. Leave that for people who that's their level, that's what they want to do. That's not for you, coder. That's not for you. You need to be looking at those coding positions. And please, can we stop with the, well, I have a CCA and I was looking for a entry level. I already done told y'all to stop with the entry level stuff, because if you're looking for them to say magical words, entry level, you're never going to find it. Or if you do find it, guess what? 1,000 other people are looking for that too. And 1,000 other people who don't know or can't do their research are all going to be applying with their terrible resumes. And they're going to be looking for that one because they want that entry level job. Doesn't matter if you're applying for a job that requires 3 years of experience or 5 years of experience. If you have no experience and they hire you, they know that you have no experience. But it doesn't mean that you can't do well. How do you do well? You get the coding workbooks that I recommended, and they're in the description box. And I swear, if you ask me, I will not answer you. I will not. Only because it's literally in the description box. I have tons of videos where I talk about the recommended workbooks that I have out there that I've recommended several times, right? The Nelly book and the CPC study guide. Those are 2 fantastic books. I feel like I'm a broken record. I say it every single time. So please don't ask me, okay? I'm just saying, do not ask me, okay? Because this field is also about research. It's also about doing all that. So you need to learn to do that now while there's time to do it. And while you can, okay, now I can figure this stuff out. So the lady was saying, well, I'm looking for an entry-level CCA job and things like that. Why can't you apply for jobs that they're asking for experience? Because if employers are in that area and they're asking, because they're always going to ask for people to have experience because they don't want to train, because a lot of times when you get into leadership, right, these people don't know how to code anymore. Maybe they coded 10 years ago, 15 years ago, but they need somebody who's a coder now. They're doing their leadership thing and you're doing the coding. So if they're going to ask people for experiences, because they don't want to have to answer those questions. But if you go in there and you apply online, or you mail your resume in, you never take it in because it'll end up in the trash. But you go and you apply and they call you because they're desperate. They say, you know what? No one has applied. But this person here, this Bleu Garcia, she has applied. She has no experience. I'm just using myself as an example. I have 17 years of experience. This Bleu Garcia, she has no experience. We're going to go ahead and call her in. Let's just see what she's made out of. Hey, Blue, how you doing? I'm doing great. How are you? Doing good. Okay. What are all these answers to these questions? Okay, I got this, and this, and this. What does HIPAA stand for? And you know how many people do deer in the headlights when you say, what does HIPAA stand for? You need to know what HIPAA stands for. Because I've spoken with one of the supervisors that I know that does interviews. And she said, I said, what is the one thing that would stop you from hiring a candidate, even if they have no experience? Let's just put that aside. If they can't tell me what HIPAA stands for. I said, is really? She goes, if you don't know that, you have no business in my hospital. And I said, well, okay. But yeah, Not knowing what HIPAA stands for, just a deer in the headlights with HIPAA. Okay? But because I had the moxie to go and apply, even though they're asking for experience, they're going to tell me, hey, we're not going to train you. It's sink or swim time. If you want this opportunity, it's yours. You got it. Now it's time for me to hit the books. Now it's time for me to practice outside of work as well. Okay? Doesn't need to be the 20 hours like you were when you were studying for the exam, but it does need to be a considerable amount of time, especially in the beginning when you're maybe starting in an orthopedic clinic. Then you need to be visiting orthopedic websites. You need to be learning about your external cause codes. You need to be learning about injuries, initial, subsequent, and sequela. You need to understand what all of those mean. You need to know when it applies, okay? And you need to understand all of those things. You need to understand what they mean, all of these things. So you need to know the difference between injuries and organic conditions, because that's very important. And so that's where you start, okay? But you take the time and you learn it. And then in 2 years, when you said, okay, I've made it through my first 2 years, and now I'm thinking, hey, I started with a CPC, and I'm thinking I want to go over to a HEMA. Let me try it for the CCS, right? Because now I have experience. Let me go for the CCS. Okay. Now you're going to be studying the inpatient coding, okay? And it's going to be hard. I'm going to tell you right now, it's not easy. ICD-10 PCS is not easy. But you want to progress. You want to have more opportunities. You've worked your first 2 years in the outpatient setting, and you say, I would like to work in a hospital setting, doing hospital coding, right? Facility coding. And I want to do that. I want to do ICD-10 PCS. So then that's when you start progressing from there. 5 years in, okay, great. Now you've had time to code for outpatient and inpatient. You've made your way to different specialties. You didn't just hang out in one specialty. You're not just a family practice coder. You're not just the ER coder. You're not just an orthopedics coder. You're an every coder, okay? That's what you got to do. Hey, I've had 4 years of experience now, 5 years. I would like to be an auditor because I know a lot about the guidelines, and I know how to converse with my peers, and they respect my research abilities and things like that. And that's how I'm learning, and I'm helping wherever I can, and I'm being proactive that way. Now 5 years in, you're an auditor. So now you start learning how to deal with other people, especially when you tell people that they're wrong. The feathers go up when you tell people that they're wrong. People don't like to be told that they're wrong, especially a coder. But if you're telling a coder that they're wrong, you better bring your references. Do not be like some of these auditors that I've had in the past. Oh, auditor stands by her word. I don't care what your word is if your word is wrong. I'm not risking my credentials for you. When I have a reference that's official and you don't, other than your word, absolutely not. And you see, that's what happens. People get in there because, they have a credential that, yes, they took a test for, but did you have the experience to be able to really, truly sit for that credential? Because remember, a pass is a pass is a pass. Somebody could have the CPMA but got a 70 on it. That means they missed, if I don't know how many questions the CPMA has, if it has 100, let's just say they made a 70, you got 30 questions wrong. You got 30 questions wrong, and now you're going to try to tell me that I'm wrong? You better bring your references and your resources, and they better be legitimate. That's what I'm talking about right there. That's exactly what I'm saying. Because when you don't have that, you lose the respect of your peers. You do. Quick. I'm just saying. All right. Here we go. Hi, Kevin. Eastern Oregon. Woo. Hi, Marie. Hi, Crystal. Hi, Letty. Doing great. Hi, Anna. Hi, Joe. Kevin. Blue, I just started the training with the AAPC for CPB. It is a start, and it will get me in the door. All right. Anna says sacrifice is the key. Yep. What are your thoughts on the CHDA, the Certified Health Data Analyst? If you like numbers and you like that kind of stuff, cool. But I will tell you that that is an exclusive club. That is not an easy test to pass. I'm just saying. Kevin said, I like that speak coder speak coder, yeah. Bloom. Hi, Blue. I've been researching certifications. Do you think the CCA certification is easier? No, absolutely not. And what is a CCPA? What is that? My research says CCA is easier, which is hard to believe. I don't know where you get your research from, but clearly it's from people who do not know and who are ignorant. I'm just saying. Hi, Julie. Or Jolie, sorry. Hi, Margaret. Trial by fire. There you go. Exactly. Margaret says, I'm looking into a career change. I'm an LVN. I don't mind the pay cut. I got a leg up on in medical coding. Cool. Joe says, Blue is absolutely correct. Although I'm on the trauma registrar side of coding, I landed a job that was with only 2 years of experience that was requiring 5 years based on their description. Best channel for advice. Yes, no sugarcoating. Absolutely not. Don't forget to thumbs up. Thanks, Letty. Frank, is claims processing and data entry good for starting to know coding? Yes, it is. Yes. Yes, it is. That is going to get you exposure to the codes. It's going to get you exposure to the electronic health record. And, you know, if you get exposure to, like, let's say Epic, you know, if you get lucky enough to get someplace that has Epic, that's fantastic for your resume. That's like catnip to some of these employers, right? There's also eClinical Works, which is another large electronic health record. There's Cerner. Yes, I made a face. There is Cerner. Cerner is also another electronic health record out there. I'm just saying. But those having any kind of experience there, even if you don't get like the deluxe package of Epic, you still have exposure to Epic. Okay. Now, Epic is different at different places. Every single hospital is different size. And the thing about Epic is they nickel and dime the people. Okay. So what they do is they charge for different size packages because not every facility is going to serve the same population of patients, not going to serve the same number of patients. Some are small rural hospitals, others are big metropolitan hospitals. So Epic is going to be different based on the setting. So they will offer you training when you go in and you start your coding job, right? That's what they will train you on. What they will not train you on is they will not train you on coding. Even when I got here to my forever home, this was my third stop in 1 year. Okay, I started at my first job, the Cancer Therapy Research Center. I got a job at a hospital was my second job, and then this is my forever home, and I made it here in less than 1 year, just less than 1 year. And that was one of the very first things that my boss told me. She used to be a drill sergeant, so she's very tough. As somebody who has been around the military my entire life, trust me, I am no stranger to the military. I'm no stranger to soldiers. So I understand, and I don't take it personally. But she did say to us, the new ones that were starting, because it was me, and then like maybe a week later, somebody else started too. She's like, we don't train here, just so you know. And I said, oh, well, absolutely, I got you. And then she's like, we don't train. She goes, we've had other people who came here thinking that we were going to train them how to code. We don't do that. We'll answer your questions if you have questions, but you better have made sure that you have done your research. No problem. No problem, you know. And so that's the way that it is. That's what the real world is like, you know. So if you thought that, oh, you're just magically going to get that red carpet treatment and the rollout of the red carpet when you get there, and they're going to hold you by the hand and they're going to say, oh yes, we're here, we're so glad you're here with us, and we're going to help you along the way. You may get that. You may get somebody who's excited every time there's somebody new. I get excited whenever there's somebody new that starts at my facility. I am ready to answer questions because I like answering questions. That's what I do. However, you know, not every place is like that. You will get some people who will say, No one taught me, so I'm not going to teach you. Trial by fire. So, but yes, that's just the real world. And that's the way that it is. And I'm not saying this so that y'all are scared. Don't get scared. Don't get scared. This is not for the weak, though. This career field is not for the weak. This will test your ego. It will test your endurance. It will test the limits of your patience. A lot. It will test the limits of your patience. But if you stick with it and you improve yourself and you work on those skills, you build those skills, you are in for a wonderful, wonderful career. I have been in this career field for 17 years and I love it. I get up and I go to work every day. I'm excited to work. In 2014 was when I had my aha moment. 6 years into my career, I had my aha moment. And that's when I realized that I'm really passionate about what I do. I really love what I do, because before then it was just like, hey, this is a good job. I really like what I do. No, this is on another level. When you get to this aha moment, and a lot of people say, oh yes, I've had my aha moment. No, you haven't. No, you haven't. When you're still in school, baby coder, you have not had your aha moment. You are infatuated, which is fine, because that's what some of us need to get through some of these things that are new to us, right? We get into this infatuation mode. That's okay, you know. If it gets you past the difficult times and the times that you want to give up, that's fine. That's all fine and well. But it's having that endurance and this sticking with it, the good, the bad, and the ugly. And I've stuck with this good, bad, and ugly. I've had people that I've worked with that were not so nice, right? Other coders, right? Not so nice. I've had challenging providers. And I've had some of the best providers that I would love to work with again. But I know that they are fly birdie fly. You know, they're doing very well because I trained them well. And their experience with me was for their benefit. And they realized that. I still get calls to this day. So that's what makes me proud, right? To be in my career and to have this where I don't feel like I'm working. This doesn't feel like work. It doesn't feel like work. Yes, there's things at work that you do that are chore related. Absolutely. Everybody does. There's things that I don't like to do. There's some meetings I would rather sit out of, you know, but that's just a give and take of this career field. So take your time when you are entering this career field. Go through the paces like you're supposed to. Don't jump ahead of the line. If you're a new coder, keep your mouth shut until you learn. And when you decide to write articles, you better make sure that you have at least 3 people reviewing your stuff. So that way you can make sure that it is correct. Because whatever you say is going to live on in perpetuity, especially online. And you say it wrong, somebody's going to reference that. And guess what stupid AI does? Stupid AI relies on articles to come up with responses. So now there's an article out there that's incorrect that the stupid AI is already going to pick up on. And they're going to pass the information on to somebody else who's too ignorant to do their own research. It's ignorance, y'all. That's straight what it is. It's ignorance. Don't do it. Especially when you're brand new. I know you're trying to help, but don't do it. Okay? If you have a study group, that's something that's different. But don't write articles like you are an expert and you write it and it's wrong. Don't do it. Okay? That's all I'm saying. All right. Hi, Vanessa. Epic and ESO are big in trauma registrar work. There you go. Hi, Rupinder. Margaret says, I need a fee with what they say, trial by fire. Kevin says, I was a trucker for over 30 years. I ain't scared of nothing. There you go. I'm still waiting for my aha moment. Yeah, sometimes it takes a little bit to achieve that, you know. And sometimes you're going to go through a lot and you're going to say, "Man, I'm never going to get there." And then one day it'll hit you. One day you'll realize it. The day that I realized it, I was up early because at the time I was supposed to be in to work at 6. And I was up at an ungodly hour. Y'all don't even want to know. And I couldn't wait. I couldn't wait to get to work. Couldn't wait. And so that's when I was just like, what is wrong with me? You know what I mean? And I would get so excited because there was all these things that I wanted to share with all these coders. And, you know, sometimes coders will take your advice and sometimes they won't. And they won't take it sometimes just because it's you. You think you know everything. You're so arrogant. Yeah, I've heard it all. But that's not, if I wanted to be that way, I guess I could. But that's never been the point. My point has always been to help people, whether they know it or not, and whether they like it or not. That's the way that I've always been. I have pure motives. And those that have bad or ulterior motives will always try to see that in other people because they try to project. Okay? And that's why it's never bothered me when people say, oh, you're so arrogant. You don't know me. You don't know me. You think you know everything. No, I don't. I'll be the first one to tell you that. Frank says, is there a coding modifier book that I can buy that has all modifiers and definitions? If it was easy for me to grab my CPT book, I would show you my CPT book, the professional edition by the AMA. It has the things in the back. Let's see. I switched to Optum books after I passed the CPC, and it's such a difference and a joyful experience. There you go. That's what I love. I love Optum, and every time, you know, like before when I've gone to conference, I'm not going to conference this year, just so everybody knows. But when I've gone to conference in the past and I've seen the Optum booth, I always run over there like a complete idiot, and I run over there and I go like, oh my God, you know, like I'm such a fan, and I tell them about the channel, and they're like, really? Oh my gosh, thank you so much. They don't pay me for all the good things that I say about them, but that's fine. It's tools that will help coders and help coders to learn and learn correctly. I'm just saying. So with that said, I gotta go, guys, because I have things to do. So I will see y'all again Monday. I'll have a show uploaded. So have a great weekend, study, and I'll see y'all then. Bye.